I'm a speaker, writer, author, and I'm a well-being coach. And I own my own business doing that. Health promotion and wellness is helping people to get well, stay well. It's really primary and secondary prevention so that you're not waiting until people have such a severe disease state before you start to help them. So it's really helping people to learn the strategies for staying well and managing their chronic diseases. When I was in my bachelor's program, an instructor said that 85% of all disease and illness is due to stress. Well, my mind just clicked in at that point. I thought, well, why don't we help people reduce their stress, and that way they don't have to be sick? And that got me excited, and I set off on a path to learn more and more about stress and how stress affects disease and illness. And that took me through mental health and into organizational health, which was employee assistance programs. And I just kept learning more and more as I went along and got more excited about really being able to help people in a genuinely real way. I will tell you that according to the scope of practice that I operate under, having a bachelor's degree is the first level of professionalism. And so you can operate as an independent nursing professional at that bachelor's degree level. Now, it was in my master's program that I really got a better understanding of the theoretical frameworks, the nurse theorists that underpin my practice. And that added another dimension. I think that the more education you have, sometimes the better, sometimes not, but I think a bachelor's degree is minimum, and then moving into the master's and maybe even on to become a nurse practitioner. So you can just advance as you go along. But a bachelor's degree seems to be that's the first level of professional independent practice where you can have your own business. You don't have to be a nurse practitioner to do what I do. My average day involves some kind of usually educational program. So I may be doing a seminar or a workshop live. I could be doing it on the phone, a teleseminar or webinar. I could be writing articles and putting those online to educate the public. I'm frequently talking to my colleagues, other nurses, about health promotion and wellness. And then also I have a newsletter, and I'll do social media kinds of things. And on my Facebook page, I'll frequently post information for people about health, how to stay well, or something, the latest research in a particular area. I just did that this morning. Well, the biggest challenge is if you're somebody who wants to get a job in a hospital, that's fine. But if you understand that 97% of the population is not in an institution, they're really out in the public, you're talking about either hooking up with a clinic or your work will be so-called traditional. It's going to be out in a different venue. You might want to learn a little bit about becoming a business person. And I learned that along the way. I didn't have to know that right up front. But as I went along, that's what I found. So you might work in other kinds of venues, and that might be challenging to change your mindset from working in a hospital or in an institution. The other challenge is that if you're going to be an independent practice, you're going to learn more about how other models for getting paid than third-party reimbursement. Because the third-party reimbursement system right now is based on the medical model. And nurses are not generally diagnosing medical conditions and using medical treatments. So you may have to find more creative ways to get paid. I think the biggest benefit is you see results. You really can see the outcomes of your interventions, of your nursing interventions. And that's the most rewarding thing of all, because so often in a hospital setting, you are doing a lot of work with someone, but once they leave, you don't see them again. You don't know what the outcome is unless they come back into the hospital, which unfortunately frequently happens. So in my work, I get to see people all the time. In fact, many of my clients, I get to see them in the supermarket. I get to see them all the time. So I get to see the results of my efforts, and I get to hear the positive outcomes. And that's so rewarding. That's probably the most rewarding part of the role. I think the most important thing is good communication skills, because you'll be working directly with people and really helping them to understand, being able to put concepts, complicated concepts, into simple forms so people can really understand how to implement the strategies you're suggesting. And so communication skills are essential, rapport, really being able to work with people on an individual basis. Also, you want to know, you want to have a systems or global perspective, because you're going to help people hook up with other resources. So you want to have the kind of mind that looks at connections, how things connect, how the community resources can connect, and how people can access exactly what they need. What surprised me the most is that when I started working in the community, through organizations and individually, how respected the nursing degree is. That I didn't need a business degree. That business people respected the nursing degree. And I was surprised at that. I was surprised at how diverse how diverse the field is, because we're holistically oriented and systems oriented, which is a basic nursing understanding of nursing principle. That allows you to move in so many different directions. And I did not realize how diverse and how respected that was going to be. Well, I think every nurse needs to she needs to consult her heart or his heart. You need to follow your passion, follow what's really excites you. And that's what happened to me. And when you do that, you're always led on a path that's just right for you. You know, nursing's so diverse. And so if health and wellness is right for you, if you like to help people and really see the results of what you do, this is a perfect career for you. Most significant change in nursing has been the onset of nurse practitioners, where nurses are able to work directly with the public on primary and secondary prevention, able to do primary care with people and get paid direct for that. That is so exciting. And I think that's going to expand. I know that's going to expand. I think health reform is just, the scope of nursing practice is expanding with health reform. So I think that's going to be our future, is really working directly with the public in many different venues. What my advice to you is, get involved in the process that is in place right now to expand the scope of nursing practice. Your future is being determined by people who don't know anything about nursing. It's being determined by legislatures all over the country and nationally. So what you want to do is be involved. Get involved with your nursing association, the American Nurses Association and your state association. Also get involved with your specialty associations. So if you have a specialty in a particular area, get involved with those associations. It's nurses sitting at the table that has made the difference even in the current legislation. And I think the future legislation, legislators, just like everyone else, respects nursing, respects your view. They know we're advocates for people and we're not really just lining our own pockets. And that's what gives you such phenomenal power to make the difference. So get involved. That's my number one suggestion.